Well, thanks very much, John, and thanks for the invitation to come to this lovely, warm country. It's certainly a lot warmer than Edinburgh. I have some disclosures for you, first of all. I'm a member of the UK government body that provides advice for the regulation of animal research. I'm also a commissioner at the UK Commission for Human Medicines, which approves new drugs. But most importantly, I have sought in the past and will continue to seek funding for work in this area, so you'll understand if I try and convince you that you would be foolish not to agree with everything I had to say and to think that my way forward was the only way. So John said I could make a number of assumptions. So here they are. In vivo research probably has potential utility in developing new treatments, but most published in vivo research is false. And for me, at least 4 of the horsemen of the research apocalypse are poor experimental design, small sample sizes, flexibility in data analysis, and publication bias. And I sat through some of the sessions earlier on today, and you know, the view was that, well, we were making slow but incremental progress. But actually, if you pause for a moment, despite overwhelming evidence that these things are important, change is glacially slow. For a field that spends about $250 billion a year in research, we should and could be doing substantially better. So what is to be done? And here's a bit of a European education for my North American colleagues. What is to be done was a pamphlet that was written by Lenin in 1895, I think, in which he argues that the working class will not spontaneously become political simply by fighting economic battles with employers over wages, working hours, and the like. But to convert the working class to Marxism, Lenin insisted that Marxists should form a political party or vanguard of dedicated revolutionaries. So what does that mean for us? Well, scientists will not spontaneously become rigorous. To convert scientists to rigor, we should form a vanguard of dedicated revolutionaries to spread rigor ideas among scientists, and that's why we're all here. Some of you may know that in response to this pamphlet from Lenin, Trotsky wrote another pamphlet, Our Political Tasks, in 1904. In the internal politics of the party, Trotsky said, these methods lead to the party organization substituting itself for the party, the central committee substituting itself for the party organization, and finally, a dictator substituting himself for the central committee. You can guess what happens next. In the internal politics of research, these methods lead to the research institution, Frank, substituting itself for the researchers, the national research organizations, substituting itself for the research institutions, and finally, a Francis Collins type figure, substituting himself for the National Research Organization. So we have to be really, the point is we have to be really careful when we try and bring about changes, that we don't allow people who are iconoclastic, and this room is full of iconoclasts who I've admired for many years. We don't allow us to be driven by iconoclastics who can tell a good story, but we should have some evidence. There's another lovely little bit in the translation of this Trotsky book, which I'll just share with you. The young Trotsky tends to repetitive, excessively sarcastic, overly verbose, and generally in need of a good editor, which is reminiscent of some of my early peer reviews, I have to say. So now we come to Antonio Gramsci. For those of you who are not European, he's the guy who really nailed how, in my view, you bring about change, and in many ways is the father of a lot of the social democracy that we have in Europe. He described 2 overlapping spheres of influence or authority, a political society which rules through force, and a civil society which rules through consent. And direct revolutionary struggle, what he called a war of attack, would not succeed without first winning a war of position or a struggle over ideas and beliefs to create a new hegemony. And that's where I think we are. We're about trying to create a new set of beliefs within our colleagues, within the community, that can help them wish to change their mind. So how do we win this war of position with scientists? Well, we need to convince scientists by being scientific. We need to observe the pathogenic processes in what's going wrong, develop causal hypotheses, and try and separate causation from association. Not seen much of that today. Develop interventions, test the efficacy of these interventions, and then test the efficiency of those interventions in the real world. And that's quite a good, I think, starting point for how we might go to bring about change. So, poor experimental design. What could we think about doing where we can be confident of the salience of a risk of bias, that it actually has an impact on producing lousy research, test interventions like training and continuing professional development, editorial policies, changes in funding behaviour to reduce the prevalence of that risk of bias. That seems to be a fairly tractable problem, and I'll show you later on some of the work that we're involved in developing, trying to report measures to reduce the risk of bias in vivo research published from a number of different institutions for sample sizes, provide simple tools to facilitate power calculations and encourage everyone to see the false economy of underpowering. Like clinical trials, most animal studies are hopelessly underpowered, and it's been suggested that they're powered perhaps at about 30%. That's certainly what our data would suggest. Multi-center animal studies. Flexibility in data analysis are a third horseman. So a public assertion of the approach to data analysis prior to data collection. And I'm trying to develop this idea of a protocol light, a 4-line protocol to be registered at the start of an in vivo study, which would describe the population, the intervention, the primary outcome measure, and the statistical analysis plan, and would be locked away somewhere with a date stamp on it when I submitted my manuscript, the reviewers could check. And then publication bias, registration as a condition of ethical approval for animal studies and for publication. And this is what the Health Technology Assessment Board do in the UK. They withhold 10% of the grant award until the work's been published. And there is no reason on God's earth why our very rich institutions should not have the same thing when it comes to their animal studies. So here are some examples. This is the experimental design assistant created by the UK National Centre for the 3 Rs, which allows life scientists to put in their experimental design, and it will be critiqued by an algorithm which we've developed over 2 or 3 years for obvious flaws in that design. This will also give you a time-stamped protocol. Some of you may have seen this paper that we had in PLOS Biology recently. These are 5 leading institutions in the UK, colour-coded to protect my career prospects, and the rate of reporting of randomization and blinding and the like in their in vivo research published over a 2-year period. And some are significantly worse than others for reporting randomization, and some are significantly better. So in a project called Enki, which is the European Network for Knowledge Information, we're developing machine learning text mining tools that will report the prevalence of reporting these measures across every institution in the world, every funder in the world, every country in the world, and will just come up on a website update every 6 months. So that should induce some behavioral change, I would have thought. Multi-center animal studies, I discussed briefly. We had a European funding project, and so there is now open source, a facility for doing multi-center animal studies where you can set up your protocol online, you can put your animals into this web-based ECRF for animal reviews. It will randomize, it will take your outcome data, and it will serve it to someone at a distance to assess that outcome blinded to treatment allocation. So little things that can be done to help. And then finally, Frank earlier on kindly mentioned the Edinburgh Conference a couple of months ago, which endorsed for the first time this reward statement, which I'll leave up there for you to read. But this is essentially an attempt to capture what as researchers we think we should be doing. And the critical bit, I think, is the third paragraph. We believe we've got a responsibility not just to seek to advance knowledge, but also to advance the practice of research itself. So thank you, and thank you.
Amazing.